Thank you. It's a great honor to be here. I want to present a new technology for non-invasive counting and tracking of white blood cells in vivo. In this age of so many advanced medical imaging technologies, MR, CT, PET, and so forth, when it comes to monitoring the immune system, the gold standard is still to draw blood for a white blood cell count. White blood cells are the immune cells in the body, and a normal white blood cell count is often the first sign that something is going on with the immune system. It could be infection, inflammation, cancer, or autoimmune suppression. However, drawing blood for white blood cell count could be problematic. For example, in immune-compromised individuals, sticking needle for blood draw has a real risk of infection. That's a concern. In neonates, especially in preterm neonates, the blood volume is so small that repeated blood sampling for diagnostic purposes could lead to anemia and the need for transfusion. And in resource-poor settings, the equipment, the infrastructure, or the expertise for laboratory analysis may not be available. So we have developed this compact 3D printed microscope that can image the blood cells directly as they circulate in blood vessels. We image the lower lip because it's well perfused with a lot of blood vessels, and it has very little pigmentation. So unlike the skin, we can get good image qualities for any skin color patients. And we image at 300 frames per second. This is real-time blood flow. This is what blood flow looks like. The same video, if I now play back in slow motion, and you can see beautiful individual blood cells, mostly red blood cells, with an occasional white blood cell that comes through. The frequency of white blood cell is about 1 to 2 per 1,000 red blood cells. So we developed an image analysis pipeline to automatically count the white blood cells. And we have tested this instrument in about 30 healthy volunteers. So these volunteers, they get their lip imaged, and they also get their blood drawn, so we can compare our count with the standard laboratory count. And if everything matched perfectly, the plot should show a ratio of 1, meaning they agree perfectly. You can see the data scatter around 1. Each data point is a single blood vessel. The scatter is real in that the number of white blood cells going through individual microvessel is not the same, depending on the vascular tree where they are. But if we image multiple vessels and average a count, then you can see we converge, the number converge to 1, meaning our measurement agrees with the laboratory analysis. The measurement time is about 3 minutes per blood vessel, and we're developing an instrument that can image multiple blood vessels at once. Beyond blood cell counting, we can also track the motion of white blood cells. So blood cells move in the blood vessel like cars move along highways. And they need to know where to exit, right? So in places where white blood cells are needed to fight infection or repair damaged tissue, they need to know where to exit the blood vessel. And the traffic signal is provided by endothelial cells that line the inside of a blood vessel. So when endothelial cells sense danger signals, they increase their adhesion molecule expression, and that will make the white blood cells slow down, roll, and come to a stop. So this is a classic textbook drawing of this process called leukocyte-endothelial interaction. That is the first step of leukocyte recruitment into tissue. We can now see this process directly in a human microcirculation. You can see the white blood cells roll on the endothelial surface. And this is exciting because increased leukocyte-endothelial interaction is the first sign of inflammation. So in an example of inflamed tissue, you can see many white blood cells have slowed down and come to a stop, so causing a traffic jam, basically, on the highway. And we have developed a pipeline to automatically track the motion of white blood cells. And from that, we can calculate the rolling velocity. And you can see we can distinguish very well healthy tissue from inflamed tissue. So, and it's important to point out that this cell motion can only be done in vivo. There's no equivalent laboratory test. Yeah, so to summarize, we have developed a compact microscope that can image the human microcirculation. We have an image processing pipeline that can automatically count white blood cells without drawing blood. And we have demonstrated this in about 30 healthy volunteers. And we have also demonstrated that we can track the motion of white blood cells, and this could be a paradigm-changing way of diagnosing inflammation by seeing these early steps of immune cell recruitment. We have filed IP for this instrument together with the analytical pipeline. And the next steps are to complete the design of this instrument, to package it from a laboratory prototype to an all-in-one system that is easy to transport, easy to sterilize, and automate the entire machine learning pipeline to track the white blood cell motion. We have now IRB approval to start imaging bone marrow transplant patients, as well as neonates at Boston Children's Hospital. And we're about to launch a startup company, and we're happy to talk with potential partners. Specifically, we're interested in talking with potential partners that are developing therapeutics targeting immune cells or the inflammation pathway. We think our technology will be useful in selecting patients and monitoring response to therapy. So I want to thank the people who did this work, our clinical collaborators and funding agency, and with a special shout out to Arujun, who developed the microscope, and Joao, who developed the analysis pipeline. Thank you.